Hello and welcome everyone. My name is Dr. Senthil Jayaseelan. I'm a consultant anesthetist and a pain specialist. This is a video series which we are doing, which is called the Eye Opener series about various medical specialties. The idea of this video series is to give some information to our young medical students about different specialties in medicine and surgery. So today I've got a great friend of mine, Professor Arun Kumar, who is Associate Professor of Cardiothoracic Surgery in a teaching hospital in India. So without further ado, we'll go to the questions which I'm going to ask Professor Arun Kumar, which will be useful for the medical students. Hello, Professor Arun, how are you? So today I've got some questions for you in the area of surgery. I know that you're a cardiothoracic surgeon, but I'd like to ask some questions about general surgery as well as cardiothoracic surgery, so that the students who are watching this program can get some idea about what's going on in your area. Okay. So my first question is, as a medical student, if I'm thinking about a career in surgery, you can also talk about cardiothoracic surgery as well. What would you say about your specialty, which will persuade me to come into your area of surgery?
Hello, Dr. Senthil. Thank you for that wonderful introduction for me. Yeah, this was a question which was actually running in my mind when I completed my graduation, that is undergraduation MBBS. I was totally perplexed what I'm supposed to do after completing my MBBS. So there were two roads ahead of me. One is a path of general medicine, the other is a path of general surgery. So I was totally confused what to take. So before that, let me narrate a small story, what happened in my life, so that it will be useful for the students to understand what they're supposed to do. Like when I was doing my surgery rotation, as everyone would do in their MBBS curriculum, one of the chief doctor, he was seeing me operating on an elective case of appendicitis. So I was doing my surgery, and he found my surgical skill, and he came to me and he told me that, I think, doctor, you have to take general surgery as a career. So I was just wondering, because I had in my mind to take my general medicine as my career and to become a cardiologist in the future. Then this gave me some idea about what I'm supposed to do. Then I slowly developed interest in general surgery. Started reading more about general surgery, history, and other things. So I started reading and took up the competitive exams after completing my MBBS UG curriculum. And then I took my rank and I got my emergency rotation post. Then it went on like that. So after that, again, after completing my emergency surgery, the next thing anyone would wonder is, what is the super specialty going to do? Now again, during the rotation of general surgery, I was exposed to various branches of super specialty like plastic surgery, vascular surgery, cardiothoracic surgery, and gastroenterology, and surgical oncology. So in that way, I got exposed to cardiothoracic surgery. And again, when I went to the department, I was so fascinated by the different kind of what they do, and namely the bypass surgeries, valve replacement surgeries, and other surgeries, thoracic surgeries, etc. So I made up my mind to become a cardiothoracic surgeon. So this is how I made myself into a surgical career and made myself a general surgeon first, and then later became a cardiac surgeon. Now, when you asked me the question of what are the positive aspects of this general surgical fields, so which would help any medical student to take up this career, a lot of which I can say as positive aspects. But let me narrate a few things. Now, when you take up a general surgery, you read the pathology, you read so many clinical signs and symptoms about various conditions in surgery. But the most thrilling aspect of this is you see them in front of your eyes. You see the pathology in front of your eyes. So what you're going to do, just going to diagnose thing clinically, and with your own eyes, you see the pathology. You operate on this kind of patients. Show your surgical skill. Remove the disease part, pathological part. It can be anything, an organ or a small portion of an organ. So you just, you cure the part by removing the pathological thing. Then comes the post-operative, that is totally different. But in spite of that, it gives you an immense satisfaction of dealing the disease then and there, and you get an instantaneous satisfaction that you removed a particular part, disease part. So this sense of satisfaction, I can definitely tell you can definitely get in general surgery. So this is in general surgery. When you come to cardiac surgery, again, for example, in case of pneumatic mitral heart disease, which is very rampant in India, even now, we remove the disease part, that is mitral valve, entirely and replace it with the processes. It can be a bioprocess or mechanical processes. And you see the post-operative course of the disease, the patient becomes very good. Hemodynamically, they can improve. So with your own eyes, you can feel the patient's improvement. And that is the most positive aspect of taking cardiac surgery. So I think these two things, like what I told you on general surgery and cardiac surgery, will definitely give an impetus for the budding medical students to choose their career as general surgeons first and then later on to become cardiac thoracic surgeon. So I strongly recommend people to take this general surgical career. Yeah.
Now we've talked about the positives. Now there is always the other side to a coin. So are there any challenges in your field which has made you regret making the choice of taking the specialty, or if you've never regretted taking the specialty, I just want to know about any problematic areas in your specialty that I should consider as a medical student before taking up the specialty.
Yeah, Dr. Sandil, as you already told, there's always the other side of coin. Yes, I would say there are certain things which are very challenging for you when you take up a general surgery career, and in particular cardiac surgery. I wouldn't say that there are negatives actually, but there are some challenges you definitely face. For example, let us take from general surgery. In general surgery as such, if you go and operate during an emergency, you will not know the diagnosis. You will be totally left in dark. So that's a challenge actually you face always. For example, let me tell you about a road traffic accident patient who comes with a distended abdomen and a hemoperitoneuria, suspected hemoperitoneuria. You won't have any clue where the bleeding comes from. So that's a challenge you face in general surgery. And this is only a part of the tip of iceberg I've given you. There's a lot of other things which are submerged. So these are the challenges you definitely face in general surgery. It is not like that you definitely know the diagnosis, go there and operate. So these are the challenges definitely you will face. So in case of cardiac surgery, it will be altogether different. For example, even suddenly faced with challenges of sudden unexplained cardiac tamponade or cardiac failure. It can be post-procedure or intraoperatively. And at that time, you have to think, you have to take decisions based upon your experience, based upon the experience gained from working with your seniors, and based upon your textbook knowledge and all. So these are little challenges definitely facing in surgical career. I definitely say it's not a cakewalk in general surgery. It's going to be a real challenge for you in general surgery and cardiac surgery. But then these challenges are taken as a thrill. It's taken as a thrilling experience. You'll be so excited and you'll have a very good sense of satisfaction when you do all these challenging cases. And when the outcome becomes very good, what more you want? You'll be the most happiest person on this earth. But again, there's another extreme. For example, in both surgery and cardiac surgery, you may land up with some problems intraoperatively and postoperatively. And to be on the worst part of it, you can even lose a patient on table or after surgery in the postoperative period. That's one time when, as such, a general surgeon or a cardiac surgeon will feel a little low in their life, losing the life of their dear patients. This is going to happen in your career, and never lose hope. So this is something which is going to happen. It is inevitable. It happens. But you should learn from what are the problems happen during that time, and never give up. Never ever give up. It's all experience in your life. So that challenge you're supposed to take then and there, either in general surgery or cardiac surgery. The other aspect, what I can tell you is like the time period in general surgery and cardiac surgery. In general surgery, it is okay, but in cardiac surgery, definitely will take a lot of time. The time duration is going to be very big. It's going to be vast because certain surgeries, like the aneurysm surgeries for matter, you have to take the case from morning till evening. So you will see the dawn and dusk yourself, with your own eyes you will see. So that you have to get geared up for that. So that's not going to be any big problem. After all, you have chosen the path, you have chosen your career as cardiac surgeon. you have to live like that. So that's not a big issue. Secondly, what happens is the remuneration part. You never expect remuneration to come immediately after completing all this courses, emergency or cardiothoracic surgery. It's going to happen slowly, but progressively you try to earn more. So never think that you're going to become a big landlord in a short span of time. Okay, after all, Rome was not built in a day, as you know. Slowly and progressively, you increase your earning potential, and you'll get very good potential once you become a very experienced surgeon. Then, last but not the least, the time spent with the family and your friends might be getting reduced both in general surgery and cardiothoracic surgery. But I would say you can allocate your time accordingly, according to the professional time and personal time. So these are the things which may feel a challenging aspect for a general surgeon and a cardiac surgeon. But I don't say this as negative vibes or things. But you can change this negatives to positive things. It all depends on your attitude. So I think there's going to be only challenges they will be facing. They will not call as negatives. And I think this is their benefit. Okay. Yeah.
That was very good sort of information, a very balanced view, I would think, because every specialty will, of course, have negatives and positives, and mostly they are all positive anyway. So if I am a medical student, I want to prepare to be a surgeon, what should I be doing? How should I prepare?
Yeah, I can just definitely guide how the student has to prepare and take up the general surgery and the cardiothoracic surgery as a surgical career. So I can say both sides, like how they have to go about in India as well as in UK. So in India, after completion of MBBS, you write a competitive examination to take up general surgery. So they give based on ranks. You go to the respective institutes and take up general surgery. It's a 3-year course. So at the completion of 3 years, you get the degree of MS General Surgery in India. And then after this completion of MS General Surgery, then you have to sit and start preparing for the exams, entrance exams called NEET, which is both for under post-graduation MS and MCH. And then you get a rank based on your rank, you get respective institutes. Then you do a MCH cardiothoracic surgery in a particular institute for 3 years. So after completion of 3 years, you become a full-fledged consultant. So this is the way what we do in India. So first you take up an entrance exam, NEET exam, become MS General Surgeon, then take again NEET exam, complete a MCH, and then become a cardiac surgeon. So this is what we do in India. When you take UK, United Kingdom, you go there and you take up the rotation postings in general surgery. Then you take the exams called MRCS, which is member of Royal College of Surgeons. You have 4 Royal Colleges, and you can take choose any one of them. At the completion of your examination, you are awarded the degree called MRCS, which is a diploma degree, equivalent of MS General Surgery in India. Then after completing that, then you go to rotation of cardiothoracic surgery, where you can do rotations in both cardiac and thoracic surgery separately. And then you sit for the exit exam called CCST. After the exit exam, then you'll be given the certificate and you'll be made as a consultant there in United Kingdom. So these are the 2 ways of becoming a consultant in India as well as in United Kingdom. So I think the students can choose their path, either take up the degree here in India, and if you want, you can take up the degree in UK also. You can combine both also. In fact, after completion of your master's degree, you can take an FRCS exit exam, whichever field you want. For example, you can take in plastic surgery or surgical gastroenterology oncology there in United Kingdom. So it depends upon the medical student. You have to choose where do you want to practice, what do you want to take as a degree. Yes, this is how you take up the degree of, you become a general surgeon and cardiac surgeon in India as well as in India. Yeah.
Really useful, Professor Arun. Thank you. Thank you very much for your time. I hope this interview will be very useful for the medical students. One more thing before you go, Professor Arun, would you be happy to take questions in the future from the medical students about this? Because they may be having a lot of questions. So that'll be useful for them. So I just wanted to ask if you would be happy in the future to take some questions.
Yeah, no problem. I'm very happy to guide all the medical students. So I'll be very sure you can ask any doubts and questions to me regarding your medical career, and especially about taking your surgery as your career and cardiac thoracic surgery in particular. So I will be more than happy to help your young students. Thank you, Professor Narayan, for this wonderful opportunity you have given to me. It was a wonderful discussion we had. Thank you. Bye, and all the best for the medical students. Cheers.